2 years after an Israeli doctor pioneered a new procedure to remove or reduce an Adam's apple in the throat without the visible scarring, this breakthrough surgery has now been performed for the first time outside of Israel. This rather revolutionary procedure offers new hope, especially for transgender women who are struggling with visible physical signs still of masculinity. A conventional method of accessing the thyroid area, known as transcervical approach, requires often a 4-centimeter incision. Doctors then can shave down the cartilage, commonly referred to as an Adam's apple. But about 20% of patients are left with a visible scar. An old technique for these kinds of shaves could take up to 6 hours. Now it's down to just 60 to 90 minutes. Patients can return home the next day. Over the last year, Professor Avi Hefetz has performed this unique surgery 10 times, arousing interest, of course, and curiosity from surgeons around the world. Now it's been adopted in the U.S. with the first surgery of its kind taking place a few days ago in New York City. With me now in studio is Professor Avi Hefetz, a world-leading head and neck surgeon, and joining us in New York, Dr. Victoria Banuchi, who just performed this surgery a few days ago. Both of you, thank you so much, doctors, for being with me. I'll start here in studio with you, Professor Hefetz. Tell me more about this kind of surgery. How are you able to do it in such a much shorter period of time, much less risk of any scarring or long-term signs? How do you do it?
Hi, good morning. We've actually performed many endoscopic surgeries, including thyroidectomies, parathyroidectomies, and minor neck dissections through the same approach. We've performed probably up to 200 cases, 200 patients. So we are getting better in the approach, and then the approach is exactly the same. What we do is enter to the vestibule of the mouth, underneath the skin actually reach either the thyroid cartilage in the case we're talking today, but we can reach the thyroid gland or the parathyroid gland and remove them. And once we get good with the approach, we get good with all kind of surgeries using the approach.
So kind of just like an airplane. Once the approach is lined up, once everything is fine, heading towards the runway, the rest is rather easy. It's the lineup, the approach, getting in there that makes...
I always wanted to be a pilot, so at last.
So is it true that the old way, I mean, it would take 6 hours, sometimes 7 hours because of the shaving and the technique involved? I mean, that's a rather lengthy time.
Yeah, the approach at the beginning took us a couple of hours, maybe not 7, but 4 or 5, maybe 6 at times. Now it's down to 1.5 hours, something like that. The shave is a little bit faster than the thyroidectomy, although it's unique, but I think it's easier than performing a thyroidectomy. So Vicky is going to tell us in a minute how it is doing the first time after doing a couple of endoscopies already. I think it's rather easy.
And doctor, you've performed this particular technique already in the last year and a half on about 10 people? Are they
exactly 10 patients?
10 patients, mostly transgender women who want to remove the vestiges of an Adam's apple?
Right, mostly, but not only. Also a woman that her thyroid cartilage or Adam's apple was pronounced, and she was once beaten on a train in New York because they thought she was a transgender, although she wasn't. But it's crazy, so she really wanted it out. And another one was a man who just was too bulky and interfered with his aesthetic, and he wanted it off. But mostly transgenders, yes.
And of course, this offers a really special new way for transgender women, a much less invasive and lengthy procedure here. I want to turn to New York. Dr. Banuchi, how did you hear about this surgery? I mean, this was an Israeli technique. It's not a widespread procedure yet. There in New York, how did you know about it? How did you come to terms with applying this procedure yourself?
Hi, thank you for having me. So excited to talk about this procedure. So essentially, Dr. Hefetz and I have known each other for a few years. So we've been involved, as he mentioned, in pioneering this approach for thyroid and parathyroid surgery, which is something that we've been doing very successfully. And the first time I heard him speak about this procedure, I knew I had to learn how to do it. I had good experience with the transoral approach for thyroid surgery, and I had seen myself how close this anatomical structure is when we're doing this approach and the great visualization that we get endoscopically. So I knew right away I wanted to learn, and we started conversations. And basically, he took me step by step, and even remotely, this is something we wanted to do together. But because of the pandemic, we weren't able to do it. But we kind of remotely were able to coordinate how to do this safely on our patient. And I think it's a great technique. We were successful, and our patient's very thrilled that she doesn't have to wear a scarf for the rest of her life as a telltale sign of what she's been through.
And as a surgeon, I'd imagine, a surgery that used to take 3 or 4 hours, if not longer, dealing with that part of the body, you can now do it and shave down cartilage in an hour or so. I mean, that's ideal, I'd imagine, for a surgeon.
Yes, I think, we're thinking about the long-term effects for our patients and the long-term result. And the one annoying thing is that visible scar that we've now eliminated. And it's great that, we've spent all this time and energy developing this approach of doing scarless surgery for thyroid.